Hello everyone. Today we will talk about SSRI or Selective Serotonin Reuptake Inhibitor. These are second generation antidepressant. We know that tricyclic antidepressants are the first generation of antidepressants. These are second generation because they specifically block receptors and the uptake of neurotransmitters, but there was no selectivity in the first generation antidepressants. Moreover, these are safer, better tolerable, and better acceptable than the first generation antidepressants. Due to these properties, these are the first line drugs in depression. Also, they are used extensively in anxiety phobias, OCDs, and other related disorders. These are first line drugs in depression since they have many advantages over other antidepressants, like they produce no sedation, no or little sedation, they do not interfere with cognitive or psychomotor functions, they produce little anticholinergic side effects, they do not produce postural hypertension. This is an important point. Postural hypotension they do not produce, and so they can be used in elderly. They do not produce postural hypertension because they are devoid of alpha adrenergic blocking action. They do not precipitate seizures. There is no risk of arrhythmias, no arrhythmia. Why no arrhythmia? Because they do not inhibit cardiac conduction. No inhibition of cardiac conduction. No weight gain. If a person is taking these drugs, he or she will not gain weight. Also, these are preferred for the prophylaxis of recurrent depression due to freedom from psychomotor and cognitive impairment. Since there is no cognitive or psychomotor impairment, so these are preferred for the prophylaxis of recurrent depression. Now, after talking about the advantages of SSRIs over other antidepressants, specifically TCAs, we will talk about the adverse effects of these drugs. Adverse effects are mostly gastrointestinal, and it is due to the stimulation of serotonin receptors, 5-HT3 receptor. 5-HT3 receptor, when stimulated, produce nausea. Loose motions are also produced. Loose motions are due to the uptake serotonin. Since the uptake of serotonin is blocked, so due to the blockade of serotonin in the gut and due to the activation of serotonin receptors on the enteric plexus neurons, loose motions are produced. Also, they interfere with ejaculation. These are the major side effects. Other side effects includes normal side effects that are produced in almost every drug used, like headache, restlessness, nervousness, and others. In spite of these adverse effects, the acceptability of these drugs is better. Also, one important adverse effects is related to the impairment of platelet functions. So since the platelet functions will be impaired, what will happen? It will lead to bleeding. So epistaxis and other bleeding disorders like ecchymosis, minor bleeding, the risk of these are increased due to the impairment of platelet functions. Also, when these drugs are taken with serotonergic drugs, they produce a syndrome known as serotonin syndrome. Serotonin syndrome. So, what is serotonin syndrome? Serotonin syndrome is produced when a person who is on SSRIs take other serotonergic drugs concurrently. What can be these serotonergic drugs? These can be like MAO inhibitors. Like if a person is receiving SSRIs and he or she takes MAO inhibitors concurrently, it will produce serotonin syndrome. It is manifested as restlessness, hyperthermia, sweating, agitation, rigidity, all this followed by convulsions. Also, discontinuation reaction is produced and it consists of paresthesia, agitation, body ache, sleep disturbance, bowel upset, etc. So, we talked about serotonin syndrome and discontinuation reaction. Now we will talk about the drug interactions. SSRIs interact with many drugs and inhibit the drug metabolizing the isoenzymes CYP3A4. CYP3A4 is an important isoenzyme and is related to the metabolism of many drugs. So remember this. It inhibits other isoenzymes also, but CYP3A4 is important. It also elevates plasma levels of other drugs like TCAs, warfarin, beta blockers, and some benzodiazepines. Now we will talk about individual drugs. Some important points about the individual drugs in this group. First is fluoxetine. Fluoxetine is the first SSRI developed. It is long acting, but the onset of antidepressant effect is slow. It is used for depression and OCD in children mainly, but not used more commonly nowadays. Second is fluoxamine. Fluoxamine is used for generalized anxiety disorder and OCTs. It is shorter acting since there is no active metabolite. Discontinuation reaction can occur in this. Discontinuation reaction can occur in fluoxamine. It is shorter acting. Fluoxetine is longer acting. Remember, it is longer acting, but the onset of antidepressant action is slow. Whereas fluoxamine, it is shorter acting. Why shorter acting? Because no active metabolite is formed. The third drug is paroxetine. Paroxetine is not so important, so just remember the name. And this also no metabolite is formed. No metabolite in fluoxamine and paroxetine, so it will also be a shorter acting drug. Next is sertraline. Sertraline is a longer acting since active metabolite is formed in this. This is used for anxiety and post-traumatic stress disorder. Post-traumatic stress disorder PTSD. Next is citalopram. Citalopram is the preferred SSRI for mood disorders and in premenstrual syndrome. So remember this, in premenstrual syndrome, there are mood disorders and that can be corrected by using, not corrected, but it can be treated with citalopram. But this is dangerous to use since overdose can be lethal and should be avoided in patients who are likely to attempt suicide. Next is escitalopram. Escitalopram, this is also not so important, just remember the name. The next drug is dapoxetine. Dapoxetine. This is a specifically developed for the treatment of premature ejaculation. It delays premature ejaculation and can be taken 1 hour before sexual intercourse. But remember, for premature ejaculation, the primary therapy is behavioral therapies. If that does not work, then we can treat with this drug, dapoxetine. Other uses of SSRI include, like we talked about, we can use SSRI in OCD, panic disorder, social phobias, eating disorders, premenstrual dysphoric disorder and other disorders. Can also be used in other anxiety disorders. Kleptomania is like some people have a habit of like whenever they go somewhere they want to steal something. Like if they will go to your room, they will feel like I should take this bottle or I should take this pen. Then that doesn't mean they are a thief, but it is due to some disorder that they feel like stealing things. So now we talked about dapoxetine. Dapoxetine is used for premature ejaculation. Another drug that is clomipramine, 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 clomipramine. Clomipramine is also used for premature ejaculation, but this is slower acting and dapoxetine is faster acting. So for SSRIs, that's all. If you like this video, please tell us in the comment section. Thank you.